Welcome to Primetime, a show for adults in the prime of life. I'm Susan Hoskins, the director of the Princeton Senior Resource Center. We're a nonprofit organization providing programs and services to older adults, their families, and caregivers in the greater Princeton area. We seek to educate people about current issues and connect you with the resources that you need. Visit us at the Suzanne Patterson Building behind Princeton Borough Hall or at Spruce Circle, or visit our website at www.princetonsenior.org. The contact information for us and our guests will be on at the end of the show. Today, we're talking about Medicare and the open enrollment period. My guest is Harry Purnell. Harry is a retired pension actuary whose career included working for more than 25 years for an employee benefit consulting firm, assisting large employers with their benefit programs. For the last 11 years, he's been a volunteer counselor for the State Health Insurance Assistance Plan, also known as SHIP, which assists individuals with Medicare problems and options. To make a SHIP appointment, call 609-924-2098, extension 14. And again, we'll have that information up for you at the end of the program. Welcome, Harry.
Glad to be here.
So probably the first question that I should ask is, tell us more about the SHIP program. I know that you've been a volunteer for many years and have helped many people figure out what to do in this sometimes complex world of picking a Medicare plan. So tell us about the SHIP program.
Sure. The SHIP program is designed to train and keep up to date counselors, volunteer counselors. Every counselor in the SHIP program is a volunteer. The state gets a grant from the federal government and is responsible for administering the program, and they train the volunteers. So when you first apply to be a volunteer, and we'd welcome to any more of us to join
Another
us.
Another good point. So if you're interested in being a volunteer,
you start with a rather intensive program that trains you in the Medicare program from A to Z. You really learn, no matter how well you may think you understand the program, you're going to learn a great deal more. And also other programs. We occasionally help people with long-term or long-term care insurance questions, with other insurance problems they may have. Okay. But the focus is on Medicare, and Medicare is very complex. There's many options that an individual can choose from when they first become eligible for Medicare. So you have this training. Then every 3 months there's an update of the training, a new training session that's done on a county-wide basis. We have about 24 counselors here in Mercer County, and 2 of them, myself and another colleague, focus on the Princeton area.
Okay. But even if someone's watching in one of our neighboring communities, because the show does show throughout communities in the county, there are SHIP volunteers in every community.
Since there's only 24 of us or so, it's not every community, but certainly there should be one nearby. I often see people from Hopewell or Lawrenceville or other towns.
And because it's a state program, there are also SHIP programs in other counties.
Oh yes, in every
Jersey.
county in New Jersey. That's really the terms of the federal grant that the state receives, is they must maintain the program in each county.
And that's true in other states as well.
Yes,
So
it's 50 states and Puerto Rico and Guam and the Virgin Islands. There's
what are you doing here?
I don't know. That's where I should be, I think.
A working vacation. Well, I think that one of the things that I've always appreciated about the SHIP program is that because you're volunteers and you're trained by the state, you really can answer questions for people, or they can come to you with questions without any fear that you're selling a particular product.
Yes.
That you're not pushing one product over another. And I think that so many people, particularly older adults, are feeling vulnerable to the heavy-duty sales pitch and to people being fraudulent or misleading. And you know, I witnessed one of them recently where this person just kept at it and at it and at it and at it because he felt he had a potential sale. And I could feel the person he was recruiting sort of wilting under that pressure. And that's not something that happens when you visit a SHIP counselor.
No, it certainly isn't, and you're absolutely right. There's, I mean, you're too young to experience this, but around the 1st of November every year, someone who's eligible for Medicare, their mailbox starts to fill with all sorts of solicitations for different Medicare programs that the insurance companies. So it's
some of which are pretty scary.
And-
You're
and-
in danger of losing your
they can
current coverage, kind of.
Yes, they can present it in a way that is frightening, and that's a shame because you know, it's complex, and there's the choices that we seem to get more and more choices rather than fewer and fewer in the program, and that makes it all the more difficult, particularly for an elderly population.
Or they're adult children caregivers who are trying to sort things out for mom and dad. I think a lot of the people that I see may be family members who are trying to make sure that their parents are getting the coverage that they need.
That's right.
And we're even more clueless sometimes.
Well, of course, you're not involved with the program, and so we often have a beneficiary who has a representative, a family member typically, that comes with him or her, or just comes alone to gather information to help their parent or whatever. And it works in the other way too. Of course, Medicare covers the disabled population. And I've recently been dealing with a case a situation where it's the parent that is dealing with me and trying to make sure he's helping his son to get the right coverage.
Great. Now, one of the things, I think some people just get so overwhelmed with sort of the alphabet soup that goes with Medicare. So let's just start with the basics of what is Medicare A, B, C, D.
Well, that's a good place to start, and it's not as simple as the ABCs, but it comes that way. Part A of Medicare covers hospitalization and also a stay in a skilled nursing facility, and so that's really the hospital side of the equation. Part A does not require a premium. If you're eligible for Medicare, you get Part A without paying an additional premium. So in that respect, it's a little simpler than Part B, but it has its own terms. There's a deductible when you are hospitalized that is over $1,000 that Medicare does not pay, and there's also, if you're hospitalized a long period of time, the Medicare coverage begins to carve out, and you're responble for some
Carve out meaning the amount they pay diminishes.
Yes, that's right. Today it happens very rarely because it's after 60 days of hospitalization.
But hospital stays have gotten shorter
and
and
that's
shorter.
right.
But the long-term care days sometimes make up for it. So A is the hospitalization coverage. Then B
is physicians and testing and the B would cover durable medical equipment, such as wheelchairs or other
Walkers, canes.
Yes, all the equipment that Medicare does provide, and B is provided. Unfortunately, there's a premium associated with B, and that premium for 2009 for this year is $96.40, and maybe later on we can talk about what's going on for next year, but and that
and that's a monthly premium.
That's a monthly premium.
So monthly you pay that cost in order to have
That's
the
right.
coverage.
Now there are higher premiums that certain high-income individuals are charged, but the vast majority of Medicare participants pay the $96.40 rate, and then it's structured in a similar way to the hospital in that there's a deductible. The deductible's over $100 this year, and it doesn't take very many doctor's visits to get the deductible exhausted, and from that point on, Medicare pays 80%.
Right.
And the and I should explain 80% of what. For every conceivable function that a doctor could perform, or there's a code that relates to that service, and there's a Medicare charge associated with that service. So Medicare maintains this huge data bank of charges, and that is what the doctor is going to charge. The doctor is entitled to charge up to 15% more than that, and that sometimes happens, but typically they charge that Medicare charge. So if they do, then once the deductible is satisfied, the member just is responsible for 20%. The doctor will collect 80% of the charge from Medicare, and the individual is responsible for 20%. And that's true with certain tests as well. Some tests don't have a deductible associated with them, but most do. And that is basically the way Part B operates. And now Part C is the part of the law that provides for Medicare Advantage plans. And a Medicare Advantage plan operates in a way where the insurance company that sponsors the plan effectively takes over from Medicare and will provide all of the medical services to the individual. And they do that typically through an HMO, health maintenance organization practice, where you have a primary care physician who's really the quarterback of your medical services, so that you need a referral from that primary physician to a specialist, and that specialist or the primary doctor, if you need to be hospitalized, they would see that you're hospitalized in a hospital that's part of the group that the insurance company has. And
my sense is that a lot of people of my generation who switched to HMOs or were only offered HMOs a long time ago have less difficulty understanding how those plans work than people who were used to traditional insurance with full choice.
That's correct. You know, I see that now. I see that now in so many people who are newly becoming eligible for Medicare who are quite familiar with the HMO model, and they like the idea of the Medicare Advantage plan. They also would provide prescription drug coverage through the plan. And the way it works is Medicare pays the insurance company that sponsors the Medicare Advantage plan an annual fee that I guess is negotiated company by company with Medicare, but that is what they get. So they get.
So if they keep you well, they make out well. If you use a lot of coverage, then they lose
that's correct,
on you.
on any
very similar to the HMOs.
Oh, it is. It's really much like that. Now, some of the programs have the ability to go out of network, where it's you're not confined to the list of doctors that or hospitals that the. And so there is some variation in the practice there. They typically charge a higher premium for the ability to have that provision.
Now, I want to make sure that we have plenty of time to talk about the open enrollment issues, because we are timing this show to help remind people that it is open enrollment time between November 15th and December 31st. And to talk about that, but one of the open enrollment issues then is Part D. So let's go over Part D quickly, and then we'll go on with the open enrollment.
Very good. Yeah, the Part D is the prescription drug coverage for a Medicare person who elects to be in a Medicare Advantage plan. The prescription drug plan is included. But for those who do not, they need to select a Part D plan. And as you say, the open enrollment period is November 15th to December 31st. And that, in New Jersey, and New Jersey is not much different from other states in this regard, there are 45 different prescription drug plans to choose from. And it is literally impossible to do it with a pencil and paper.
Or just by looking through the book. You brought your
That's
Medicare and You book with you.
That's right. You need to do a much different and a much more thorough test of which plans is most suitable for you. And Medicare provides you the ability to do it if you're computer literate, and it's really a fairly straightforward process.
Well, I know that we, the social workers on our team, have helped people with that, and it's one of the things that we encourage people to set up appointments with you, because you can sit down at the computer, and a person needs to bring in with them the medications they take, right?
That's right, the names of the medications, and they have to be...
The pharmacy they like to use.
Yes.
What else?
The dosage of that medication, so if it's 20 milligrams or 50 milligrams, that can make a difference. And the number of pills you take a month, or if it's not a pill form, whatever the...
So it's a good idea to either bring the prescriptions or the bottles, because it has to be exact.
That's right. The bottles are really the best way, because
But then you plug all that information into the computer, and it can give you a comparison, right?
And that's exactly right. It then, in a very short order, it ranks all 45 plans in cost order. And that cost is the sum of the premiums that you pay, any deductibles the plan have, and any copays. So that's your out-of-pocket expense, the total, and that is shown along with any restrictions there may be, where someone would have to. There's step therapy, where you must try a certain other drug first.
You have to try a cheaper drug and fail on it before you can go on to another.
There are things like that. But basically, if we just focus on the cost, what I've seen time after time, and I do this now pretty routinely when I work with people, I show them the 3 or 4 least expensive plans, and then we compare to the most expensive plans, and it is amazing the difference. It's almost always the most expensive plan is twice as much as the least expensive, and sometimes it's 3 times or more. So it really is the only way to choose a plan. That you can't say, oh, my neighbor next door has this plan, and
or I use this
so
company
I should,
for
and
other
they're happy with
insurance,
it, or exactly.
They used to be my insurer when I worked.
No, or
Right.
I recognize that name,
Yeah.
and that's how, I mean, many people have made that choice.
Well,
and
that's part of what I've sensed, is people have come in and asked about it, or when we talk to people about it's open enrollment time, this is really important, and people go, oh my goodness, it was so hard the first time, don't make me go through that again. Or why do I need to look at it again? I chose a plan 3 years ago, leave me alone.
Well, and the reason is the plans change. They change their terms. They change the drugs they cover, and so you cannot be assured that because in 2009 that this plan was the best for you, that in 2010 it will be. And that it's a shame that, but it really is necessary to do it, and I recommend that people do it every year.
Yeah.
And we do a lot of we're very active in that period, helping people do it. But that is really an important point to emphasize, that it's really important that if you don't do it every year, at least do it every second year.
So
that you
don't wait for the year that you get a notice that your company has decided not to offer plans in New Jersey anymore or something. Do check it every year or two.
That's right.
Just to be sure that you're still in the best plan. Also, your medications may change.
Well, that's exactly right. They do change. I mean, people
the medication you were on may not be on your provider's.
That's right. The new one and as I said, even if you're not computer savvy, if you have a child or a neighbor who is, this isn't a rocket science to do it, but we do stand ready, and we do it for a lot of people, and we'd welcome to do it for you.
I know the other time that I send a lot of folks to you is when they're newly becoming eligible. So maybe we also need to talk about that. Somebody comes in and says, well, I'm 64, I'm going to be eligible for Medicare next year. When should a person make that appointment, or what's the first step, and when should they do that?
Well, I would say sometime in the 6 months before your 65th birthday, and preferably with some time before, maybe in the 6th to the 3rd month, because if you're, I mean, the way it works, if you're collecting Social Security, you will automatically, they will know all about you. They'll have all your information, and they will enroll you in Medicare without you having to do anything. And then you will get a card that says, if you do not send this back to us, we will enroll you in Part B. Okay. Because Part B is elective,
so
since it has.
Part A is automatic.
Part A would be automatic.
Part B is.
That's right. But if you're not collecting Social Security, then you haven't gone through the process of proving your birth date and all, which and they are going to want you to do that. So they recommend that 3 months prior to your 65th birthday, you contact Social Security. You don't contact Medicare, because it is Social Security that will do the enrollment process. Okay. And that's not a long process. They're actually trying to make it so that you can do it over the computer on the internet, and that will be fine. If it will avoid a trip.
And then selecting your Part D plan is yet another step, isn't it?
That's right. There's really then one of the first choices you you would make. And I mean, if I were meeting someone who's 64 and a half or so, and I would explain those different options that the plan or the part A and B versus the part C. I'd want them to know about the Medicare Advantage plan. I'd want them to get a book like this. This is the
a little higher. There we go.
This is the book that's published every year called Medicare and You, and it contains valuable information, and every Medicare member receives one of these, but the new ones won't have received, or the future to-be ones won't have received it. But so we'd go over those choices. If they selected to know they don't really want the Medicare Advantage, they'll stay in traditional Medicare, then we need to select a Part D plan. And then we also need to talk about, would you be interested in a supplement plan to, I described the deductibles and the co-insurance elements of the plans where you're paying.
Right, so that 80% is covered by Medicare, 20% is covered by you.
Yeah,
those help you with the 20%.
That's right. There are, I think, 12 different plans now. They're also use the alphabet for those plans, but they each cover slightly different group of the gaps that they're often the Medicare supplements and Medigap insurance is the same thing.
Right.
But we would discuss that and see what's both needed and what's financially desirable for the individual.
It's also important when we talk about coverage and what's covered, it's important for people to understand that Medicare is a health insurance program and that it covers health insurance issues. So it covers doctor's visits, medical equipment, prescription drugs, but it does not cover assisted living.
That's right.
Home health, companions, and things like that. And some people kind of expect that anything they need will be covered. What about things like vision, dental, and hearing?
Vision, dental, and hearing, are not basic coverages of Medicare.
Traditional Medicare.
Now, in the Medicare Advantage plans, many of them have coverage for some, if not all, of those, and that is how one of the appeals of those programs. I think those Medicare Advantage plans are particularly appealing to healthy individuals who like those extras that aren't available through Medicare.
They have a significant vision or hearing or dental
yes,
problems,
that's right.
and
Now
are willing to trade that off for the management that happens with an HMO.
Yes, there are limited benefits for vision and hearing in Medicare. The dental is not present except for dental surgery. I mean, if it was, but the Medicare Advantage plans do go a lot further than basic Medicare in those regards, and they also often offer health fitness programs where they'd pay a membership in certain gyms or organizations of that sort, and so that too can be an attraction to someone.
Now we're rapidly running out of time, so can you quickly summarize some of the important things that people need to know about the changes for this year?
Okay, in 2010, Social Security will not be having a cost of living increase, no COLA, and that is because the CPI, the cost of living index, didn't rise between the third quarter of 2008 and the third quarter of 2009. Now that means that about 93% of Medicare participants will not be experiencing an increase in their Part B premium.
Okay.
No
more income, no more outflow.
That's right. There's a hold harmless provision that
Okay.
if you were a participant in 2009, and you aren't in that high income supplement where you're paying a larger premium, you will keep the same $96.40. Now, that doesn't apply to someone who becomes newly eligible for Medicare in 2010. Their premium will be $110.50. And it doesn't apply to the high-income people. Theirs would go up as well. Now, Congress is considering changing that so that some of those groups may not experience a premium increase. But so the premium for most people will be the same. There are plans, there are Medicare Advantage, certain Medicare Advantage plans have issued notices saying that they will not be operating in 2010. And if you have received that letter of that sort, it would be good to make a SHIP appointment, because we could help you with your decisions of whether you want to go to a different Medicare Advantage plan or go back to traditional Medicare, and what the various options are. You have some rights. There's a guaranteed issue right for a Medicare supplement plan for the next year if your Medicare Advantage plan has ceased operating.
So there are lots of reasons for people to make SHIP appointments, and we at the Senior Resource Center are very happy to host you and the other volunteers who come. Again, we'll have up at the end of the show the number that people can call to make a SHIP appointment here in Mercer County. You can also look for the number for your SHIP office in any other county in the country. I wish we had more time. Harry, thank you so much for joining me.
Susan, it's my pleasure.